Hi, in this video, I'm going to be talking about alcohol and breast cancer. This is a really tricky topic for a lot of people. Over the last few years, we have compelling evidence that there is a connection between alcohol and breast cancer in terms of the more we drink alcohol, the higher our risk of breast cancer. Now, you know lots of people who drink who don't have breast cancer and lots of people with breast cancer who don't drink. So this is why I call it an epidemiologic study. This is where we take populations and look at relationships. So a tendency to see more breast cancer in people who drink. And one way we know this connection is pretty solid is because the more people drink, the more the risk of developing breast cancer, but it doesn't double the risk. But it's one of those what we call lifestyle factors that can increase the risk of developing breast cancer. We don't know a lot about the role of alcohol in being associated with a risk of recurrence of breast cancer, but it would stand to reason that decreasing alcohol intake to a more mild amount than many people drink would be prudent. So you see how I'm using my words really carefully, because the last thing that you need if you drink a lot of alcohol is to feel that you're a bad person. You already have a lot of shame. You may not even be aware that you're drinking as much as you are. That's pretty common too. And we know that during COVID, a lot of people started to drink more because you're at home, you open a bottle of wine, there aren't friends coming over. So a lot of people found that they were drinking maybe double or even 3 times as much as they had been before. And a lot of people have told me they're trying to cut back, and that's a good thing to do. Just trying to cut back doesn't mean you have problem drinking. But if you're watching this and you're wondering, maybe I should cut back, I would say just that question alone should prompt you to act, reach out to somebody. There are a lot of other reasons to lower your alcohol intake as well. We used to think that drinking a moderate amount of alcohol, which for women is less than a full serving a day and for men is 1 to 1.5 servings a day, decrease your risk of heart disease. And that's actually been debunked. So there is actually no health benefit to drinking alcohol. So we use it as a treat, or we use it as what some people call a social lubricant, where it makes it easier to talk if you're shy. But in general, based on what we know now from a lot of very large studies, drinking less is good for you for lots of reasons. It's also good for people watching you, like your little ones, to see you be more mindful about your drinking. So if you're watching this and you're wondering, maybe I should cut back, what should I do? The first thing to do is to talk with a trusted friend. Talk with a trusted friend that isn't going to say, oh, you don't drink as much because they already drink too much, if you know what I'm saying, right? We all have those friends who drink with us, and the last thing they want is to lose their drinking partner. So talk with a doctor, or talk with a therapist, or talk with somebody you trust about your drinking, and be really honest. They're not going to judge you. They're not going to think you're less of a person. You already have the shame, and you're not going to be shamed. What you're going to get is advice, and that may not be as helpful as the person giving you advice will think that it is. This is really something you work on yourself in community. So what I mean by that is you can work with other people who want the same thing to encourage each other, because only they can understand what you're doing. They can understand why you want to go down. They can understand how hard it can be to cut back on alcohol. There are lots of different groups that can help. There's something called Smart Recovery. We'll put the website on the screen and below. There's Al-Anon, or AA, that's for Alcoholics Anonymous. And there are other recovery programs like cognitive behavioral therapy or dialectical behavioral therapy that can help you find ways to cope. Because if you're using alcohol to cope with stress or to help you relax, there are other things you can do. One of the things you can do on your own is, as you're about to pour your second glass, or maybe a glass of alcohol, wine, or whatever that you weren't planning on having, you can say, what is it I need right now? Do I need to relax? Do I need to be creative? Do I need distraction? And then find another way to do that. Do I need a ritual? Like if you have a glass of wine before bed, maybe a small cup of tea would be helpful. It's not going to have the same sedating effect, but in the end it will be better for you. I'm not trying to say this is easy. This can be really hard. One thing that makes it really hard is our culture just says alcohol everywhere, right? You post something on social media and you're celebrating and people comment, where's your glass of wine? So it's just everywhere. And alcohol is one of the few food products that doesn't have a serving size on it. So think about that. There's no serving size suggestion or maximum number of servings you should have, like there is with every other food or beverage product. I've covered a lot here. I've covered reasons why you might not want to drink or drink as much, different strategies that you can use for getting help, and then some things you can try for yourself to ask yourself, why do I want to drink? What do I need in this moment? I hope this has been helpful. If it has, click like and subscribe, because that'll help other people going through this who maybe are struggling with this very issue find this video. And please just feel free to drop a comment in the chat as well, and we'll answer that just as soon as we can.